Hello everyone, and welcome back to another episode of Nothing But the Tooth, a podcast series by Malaysian Dentist Student Association, MDSA. I'm Chu Zhengjie, a member of MDSA Academic and Research Bureau of the 2023-2024 tenure. For this second episode of Nothing But the Tooth, we are here at Universiti Sains Malaysia Health Campus, Kubang Kerian. Oh, I still remember when I first stepped foot here, and honestly, starting dental school can be rather hectic. And I've always wondered, did my seniors ever feel the same way as I do? Well, today you guys can come with me and let's find out with our guest today, Miss Pui Yee, one of my USM seniors. For your introduction, Pui Yee is a final year dentist student here at USM. She's fantastic at balancing her academic as well as her co-curriculars, and she holds various positions in associations such as MDSA at PSG USM, which is Persatuan Sains Pergigian, and she is surely no stranger in juggling multiple responsibilities. Today, I'll be asking Pui Yee about adapting to dental school, including some of her insights on patient care management. Once again, if you're ready, let's go. We'll give you nothing but the truth. So let's welcome Miss Pui Yee.
Hi, MDSA viewers. So I'm Pui Yee, Year 5 dental student in USM. Thank you for inviting me for this program.
Well, it is an honor for us to have you here. So, let's cut to the chase. So when you first entered dental school, how did you feel about it? Is there any difference in your expectations?
Well, I think it's pretty much the same as you. I think all of us are excited and nervous about entering dental school. I was pretty much really excited to learn what dentistry had to offer as a whole. So before I entered dental school, I had joined a few introductory workshops at some of the private dental schools and also worked as a dental assistant in a private dental clinic for about 6 months. So from there, I get all kinds of dental experience related to dentistry and advice from seniors and dentists. So that prepped me well, set my expectations there about dentistry and dental school as a whole. So I've learned from these experiences that dentistry is not only about hitting the books, but also on doing hands-on and also human interaction, not only between dentists, but also with our staff and patients. They also taught me that dentistry and dental school is definitely not easy. It's not as easy as we think, as each case always comes with a different set of challenges. So honestly, my expectations before entering dental school and now pretty much matched up with the reality. So I think that for those who are interested into going to dental school, I think the key would be to interact with your seniors or people from the field of dentistry to get to know more about it and figuring out what to expect and if dentistry is the right one for you. Yeah.
Wow, I totally can relate with you. For me, being in dental school is a dream come true for me. And there's so much to look forward to. However, despite all of the excitement of learning new knowledges, and I sometimes find it quite difficult and stressful to manage between my academics and also extracurricular activities. So, Pui Yee, I would like to ask you that I'm sure all of us would like to know how you manage both sides, because I've noticed that you held positions in MDSA, ADPSA, and also PSG throughout your undergraduate life. Yet you still excel in your academics, being the top students in class. So would you mind sharing with us a little bit of your secret?
Sure. First, I think it's a brief introduction for the viewers that dental and undergraduate life in Malaysia basically consists of 5 years, which is a 2-year preclinical phase followed by a 3-year clinical phase. So I think that managing time would be easier for me at the beginning, as it was more about studying, assignments and exams. So every day I'll basically set daily aims like revising a certain lecture material or reading the ebook about a certain topic like for revision, and discipline myself into completing them before moving on to have fun. So it's always important to have some time for yourself to relax and do what you like watching favorite shows or having fun with your friends outside in between the study sessions. Because once we move on to the clinical phase, starting from year 3 to year 5, it's quite tough to keep up with everything because there's just too much to do and it's very exhausting after clinics. I think that from there onwards, it's very tough to manage your time well. So sometimes trying to stay awake even after clinics to prep for the seminars and the lectures the next day is just mission impossible for me. So for me, I just try my best to manage my time and divide my times and manage between my studies and extracurricular activities. When I was the secretary for APDSA MD last year, I usually allocate 2 to 3 hours per week to complete my duties before diving into my individual tasks. I always make it a habit to finish my group work first so that I can focus better in my other tasks like catching up with my studies during off-clinic days and weekends. So I think that that's the way for me to manage my time. And also, as there's less time to study during clinical years, right? So I always try to keep myself motivated and avoid procrastination as much as possible. Yeah, so how I motivate myself is that I always tell myself that I want to be a better dentist. I want to be a good dentist and a competent one for my patients. So I got to keep studying and learning. So that's what keeps me driven to be a better dentist. Besides that, participating in activities outside campus like MDSA right now, APDSA, MD, and also other competitions outside school also let me get in touch with all kinds of talented dental students all over the country, which always keeps me inspired, and like meeting you, and also driven to be a better dentist.
It's an honor. Yeah. Okay. Well, you have a point. I do agree that time management is the key here because we have too many things to handle yet we have too little time. But from what I heard from you, I can say that it feels like clinical year is a lot to handle. I believe for pre-clinical students like us, we are really worried about what challenges we'll be facing and also how the clinic actually works. So with your personal experience, could you share with us what challenges that you have faced or encountered when entering clinical years?
So as I mentioned earlier, clinical years is from year 3 until year 5. So yes, during the transition phase between pre-clinical to clinical, it was really tough for me as there's just too much that I'm not familiar with. And being the class rep in that year, I was expected to find out, know, and then convey the information to the batch. So the pressure on me during that time was super immense. So basically what we're supposed to face during that transition phase is that we're supposed to get to know everything in the clinic. Like for example, how to handle patient folders, how to get patients from the waiting list, and the do's and don'ts in the clinic, like patient management skills. We have to pick that up really quick, like how to interact with the patient when you contact the patient, and how to handle the patient up till the point where you finish the treatment of the day and discharge them. So there's just too much to digest at once, I find that really challenging, but I think that at that point in time, it's important to give ourselves some time to learn, digest, and also give yourself some leeway to ask questions to those staff in the clinic because we are not sure about certain things. It's always good to ask, and they are usually happy to help newbies like us. Moreover, shifting from practicing on a dummy during preclinical phase when you are in year 2, and then now moving on to working on real patients in a clinic may also feel very different because it requires us to be alert, stay empathetic, and also act responsibly so that we can ensure that no harm comes to the patient. So besides that, dealing with patient management issues like last minute no-shows from patients or the patients not understanding our limitations as undergraduates can also seem very frustrating at times. But I think that's something that we have to cope with and stay strong throughout our career. So by looking back, I think that I've learned how to not let these setbacks weigh me down and stay strong and overcome these challenges. So looking at the little achievements, those little glimmers in our life, being grateful that we have achieved them, and also seeking advice from friends, seniors, and lecturers have been a key for me to overcome these challenges and learn more throughout my journey.
Well, that is nice. Well, for the preclinical students listening to this podcast, I hope that you guys are able to take this advice and also ace your clinical year. And for sure, it won't be easy, but I'm sure all of this will help us to be a more respected dentist. By the way, I wanted to ask you that among all of the lectures you've learned, which one of them do you find it most interesting?
I think the lecture topic about behavioral management techniques, for pediatric dentistry, because from there I was able to finally understand when I was working as a dental assistant in a kids-friendly dentist, that's how I saw the knowledge being applied there, and I finally understand more about it.
Wow, it is an interesting topic. So since we are discussing about this topic, I've known a few friends of mine that they are afraid of the dentist when they are a kid, and I've always wondered why. So I've heard about something called the pediatric treatment triangle. Can you tell us more about it?
So the pediatric treatment triangle is basically a triangle where the child will be at the apex of the triangle, and the parents and the dentist will be at the base of the triangle, and the child should be the focus of attention for the dentist and the parent who are at the base. So other than that, there's a small bidirectional arrows in between them. So this show the interconnected relationship between them and emphasizing the need for communication between these three aspects. So this triangle basically shows the dynamic relationship between them, and applying this triangle into the scenario that I mentioned earlier, I think this negative attitude of your friends being scared of the dentist when they were young can be analyzed using these three aspects. For example, the factors from the child would include the child's age, maturity, and developmental stage, which can impact their behavior and how we choose the best behavioral management strategies for that certain child. The parental knowledge and attitude can also influence a child's behavior, as the child can sense tension and fear from the parents if there's any parental anxiety at that time. Moreover, the dentist's experience at handling children and the environment of the dental clinic itself can also influence the child's behavior. For example, a more experienced dentist and a more safe and welcoming environment can be a good influence to the child and make the child more receptive towards dental treatment.
Indeed. So dentists do play an important role when treating patients, especially the children's, so that they won't have trauma towards the clinic and towards the dentist and are more willing to cooperate with the treatment. So based on the pediatric treatment triangle mentioned, how do you think parents play an important role in influencing their children's experience in the clinic?
Yes, parents play a pivotal role in determining their child's behavior during their dental visit and their treatment experience. So for what I mentioned earlier, the parental knowledge and attitude towards dental treatment is really important, as that will shape the child's dental behavior during the dental visit. So from my experience of working as a dental assistant in the kids-friendly dentist I mentioned earlier, so some of the parents told me some very interesting ways that they have used to increase the child's interest towards dental treatment before their first dental visit, especially their first dental visit, I guess. So for example, they carry out simulations or role playing their child, usually playing their toys, but instead they use dental related toys to have a role playing at home to familiarize the child with a dental setting, and also watch certain cartoons or YouTube videos related to going for a first dental visit, and also installing dentist related mobile games. And some parents even go the extra mile by being a good role model for the child, sitting on the dental chair first and receiving dental treatment with a very confident attitude, and then some even go and sit with the child on the chair while the child is receiving dental treatment so that they feel safe. So I guess parents play a really important role in influencing a child's behavior during dental treatment. Yeah.
Since we talk about parents and also the dentist, let's shift our focus to the patient, which is the children. It's been said that no two children are alike, and I'm sure that it also applies to their behavior. And is there any way that we can classify their behavior?
The common one that we use is called the Frankel Behavioural Rating Scale. So the Frankel scale basically has 4 scores. So 1 would be definitely negative, where the child is just show very extreme negative attitude, definitely refuse dental treatment, forceful crying, and fearfulness. Some examples of the negative attitude would be they are not willing to sit on the dental chair. And the Frankel 2 is the more sullen and withdrawn type of negative attitude, which is simplified as negative in the rating scale. And Frankel 3 is positive, where the child is a bit better in terms of they accept the treatment, although sometimes a bit more cautious and with reservation, but they are still willing to comply with our instructions. So that's still fine. And Frankel 4 is the definitely positive, which is the one that we dentists and dental students alike would seek for in a child or child patient that we are looking for. And because they are willing to establish a good rapport with us, and they are interested in the dental procedure itself. So they really enjoy their dental journey with us. Yeah.
Well, I find that really informative, and I'm sure with this, it will be a lot easier for dentists to categorize the children's behavior and also apply the necessary actions. And another question is that, in your point of view, as dental professionals in making, how should we communicate with pediatric patients to make sure that they are more comfortable and are willing to cooperate with the treatment?
I think the success of pediatric treatment does not only begin when they sit on our dental chair, but from the point where they walk into the dental clinic. So that's where we're supposed to create a safe and welcoming environment for the child and build rapport with the child from there. So for me, I think that it's important to let the child participate actively in their own care. I usually will talk to the child and explain the rationale of the treatment that I'm doing, for example, filling, so that they can build certain understanding towards their oral care and the importance of it. So I'll use a certain level of communication that's suited to their age, maturity, and cognitive development for that certain child. So for some children in the pre-operational period, like around 2 to 7 years old, because they cannot perceive like abstract concepts well, they can only understand the world using like the 5 senses around them. So the common technique that I'll use is called the tell, show, do technique. I'm not sure if you've heard of it, but it basically consists of tell, which is first we explain the procedure to them. For me, I will explain the rationale of the procedure and also the procedure itself, like the steps. And then we demonstrate it, we apply it onto a more carefully defined and non-threatening setting, like demonstrate it on a model, like a tooth model or something, or for example, polishing, we can demonstrate it on their fingernail, like a bristle brush onto their fingernail. And lastly, we'll be applying it onto the patient, which is do. So by doing so, we can give the child some well-described expectations and reduce the anxiety. Of course, there are other behavioral management strategies like non-verbal communication from us, like our facial expression and body language can also be used to enhance the effectiveness of the oral health message we are trying to convey to the child. And another technique that is commonly used is the positive reinforcement technique, where we give descriptive praises like, oh, Zhenjie, you did a good job sitting here and sitting still and allowing me to finish your filling for today, something like that, or give rewards like stickers or toys to reinforce the positive and cooperative behavior that the child exhibits for that day. So of course there are other behavioral management strategies that I left unmentioned, but these are the common ones that I have seen and used frequently in dental clinics, and I believe are easy to implement for everyone. So, and as you said, every child is different. So I think that all these strategies that we are using have to be applied as a targeted approach for each child.
Well, communication and interaction with the children is really important, especially in order to gain their trust. However, I believe there are still times where the patient is not at the state of communicating and are throwing tantrums during the procedure, which can be rather dangerous. So, how do you think that we should handle a situation like this?
For childs who are throwing tantrums, I think first we have to find out the reason why they are throwing the tantrum. Either it's because of the pain from the procedure, or is it due to their own anxiety? I think the first step would be from us that we have to talk to the patient, find out the reason, and also reassure them that it's not a threat. But if that doesn't work, we can ask help from the parents or guardians to persuade them, communicate with them, and reassure them. But if the child still does not show any improvement in their behavior, we can do a temporary restoration if it's a restorative procedure and postpone other relevant procedures to a later date. Then if the child does not show cooperative behavior for multiple appointments, then we can suggest to parents about dental treatment under sedation or general anesthesia based on the patient's dental needs.
Wow, that is a rather informative session. And now for the last question. In 10 words, please give your best advice to your juniors.
I think this is just something that I saw recently in social media, which I think it resonates to me as a dental student. So my advice would be, let's be the person who still tries and learn. So less than 10 words, right? So basically what I'm trying to say is that because, as I said, dentistry is not a bed of roses. So I think what's important for us as dental students would be to not give up and always seek ways to learn, as I believe learning is the only method for us to carve a new path to overcome the challenges that we face throughout our journey as a dentist in the future.
Well, thank you so much, Pui Yee, for sharing your experience in adapting to dental school and also some of your insights on applied child psychology. I believe that's a wrap for today's episode, and thank you for tuning in. We'll see you guys next time.